Welcome to the Caregiver Relief Podcast. I'm Diane Carbo, RN, your host. Today's conversation is one every family needs before a crisis happens. My guest, Annalee Kruger, has spent decades helping families navigate aging, dementia progression, and the complex senior care system, often stepping in when families are already overwhelmed and out of time. Annalee is the founder of CareRight Inc., a virtual aging consultancy, a national speaker, and the author of The Invisible Patient. Annalee helps families understand their options, identify safety triggers, and create realistic aging plans that protect both the older adult and the caregiver. So if you've ever felt blindsided by caregiving responsibilities or you worry you might be someday, this episode is for you. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Annalee, thank you so much for joining me today. We have so many things in common, and I was really excited to be able to share your knowledge, information, and talk about your book.
Thank you. Thank you for having me, Diane. But more importantly, thank you for all that you do for families across the country. We were talking before you hit the record button about you're a pioneer in the industry, helping families over the phone long before current times.
Yes. I know. I was in the Stone Ages with the Flintstones.
You know what though? There is always the demand.
Yes, and there will always be.
And there will always be a demand, and there needs to be more people out there like us who are properly trained, seasoned, educated to help these families make informed decisions as they're aging, as they're determining care options, care needs, staying at home. What do we do if mom falls again? All of the things that come along with aging and being a family or a solo ager, and be like, oh my gosh, who's going to take care of me as I age? Let's talk about it.
Yes. I want to know, Annalee, what first opened your eyes on how unprepared families really are when a medical or cognitive crisis hits? Because you've been doing this a long time, kid.
Yeah, actually my whole life. My grandparent, literally my whole life. I'm an Iowa farm kid in the 70s. I'm 53 years old. And so in the 70s, we had our grandparents move in with us because back in the 70s, there wasn't independent living. There wasn't home care on every corner. There wasn't assisted living. And so seniors at that time, or in our case, grandparents, either failed and died at home, they moved in with their kids, or they moved into a nursing home. And back in the 70s, there wasn't resident rights yet. And so terrible, terrible places to go. And so I knew by the time I was in third grade that I wanted to serve families and their aging loved ones. I just didn't know what it was called at the time, but it's called social work.
Yes.
And so I was a little girl, so I'm like, I don't know what this is, but I'm going to help families and help them navigate care. And so I spent 28 years in long-term care, working first as a social worker, admissions director. So I did all the tours and explained the facility, explained dementia, explained the levels of care. Assisted living is different than nursing home. Medicare is not Medicaid. It's all the things that families got thrust into and didn't understand care options. They didn't understand our lingo. And so I spent all this time during the tours educating families, when I would ask them, "What do your parents have in order?" 'Cause let's be honest, it's the adult kids that get thrust into this. They get that crisis call.
Yeah.
And mom's in the hospital. She's the caregiver to dad with Alzheimer's. The kids are like, "Oh my gosh, what do we do?" Now we have 2 parents that need 2 different types of care. They don't know what their parents have in order for estate documents or living wills or long-term care insurance. And so it was just always crisis my entire career as a social worker, admissions director, and then eventually executive director. So in 2011, and Diane, you'll get a kick out of this. I don't know if your listeners will, but you probably will because you know how healthcare has changed. But in 2011, I was going to get fired because I was spending too much time with the families. I was exceeding the minutes per patient per day. At these continuing care retirement communities, the ones that have independent living to assisted living all the way down to memory care and skilled nursing, I was exceeding the minutes per patient per day because I was spending too much time with families, educating them and supporting them and guiding them. But it was very short-sighted for administration because we were full with a waiting list because I spent so much time with family.
Yeah.
But
Yes.
administration was like, "We have a waiting list. You don't need to spend 2 or 3 hours with a family. Just get them in, get them out." And I'm like, "That is what's wrong with these families. No one is actually spending the time to educate them, validate their feelings, help them understand care and why dad is behaving the way he is because he has Alzheimer's, and this is what you can expect as that disease progresses." So in 2011, I decided to leave my career on a high note and on my terms. And I'm like, "Fine, I'll just start my own company because that seems so logical." And well, in fairness, I did interview for other positions in senior care, and it was more of the same. Terrible workplace culture, burnout, nobody supports each other, and I was like, "I'm gonna just sink or swim, start my own consultancy." So in 2011, I started Care Rights Incorporated, a virtual consultancy for family caregivers who are in that aging space of, we have aging parents, what do we do with mom and dad? Or I'm a solo ager, I don't have kids that I can just call and help me out. What are we gonna do? And actually do robust aging planning, facilitate their family meetings, what's working well, what's not working well, what do you have in place already for documentation, your grab and go binder. Because again, as an employee, these kids had no idea what their parents had in order. And spouses had no idea because FO will say, "I don't know, Marvin takes care of all the books." He's the one that cuts the checks and he's the one that meets with the banker and the financial planner. And so when I started my own virtual consultancy, it was to solve for the problems that I saw happening for over 2 decades working as a social worker, an admissions director, and an executive director, where families are just blindsided.
They really are.
They
Now,
are.
yeah. And what are the most common crises that trigger that moment
Oh,
for a caregiver?
mom, someone's taking care of someone else, right? So mom or dad. Mom is taking care of dad. Mom had a stroke. Dad has Alzheimer's disease.
Yeah.
The kids get thrust into caregiving. Now back when I was still an employee for those 28 years, kids lived down the street from each other so they could a little bit more easily pitch in and help out. And they seemed a little bit more in tune to what's going on with mom and dad because back then they'd still get together for after church lunch on Sunday. There was just more involvement because they lived down the street from each other. But that said, that doesn't mean that they were actually having family meetings about the what whens. And so the problems are, these are the mistakes. Mom and dad, someone has a medical crisis. There's been no family meeting about the what whens of aging, or family kids have said, "Annalee, we tried to have these family meetings with mom and dad. What do you have in order? Who's your financial planner? Do you have a living will?" All of that kind of stuff. But mom or dad gave us so much pushback that we quit trying to have a family meeting because now it was affecting the relationships. And so problems that I see family have is it's usually the primary caregiver takes ill, has a stroke, breaks a hip, or dies, which no one should ever be surprised that the primary caregiver is going to die prematurely because of caregiver burnout. No one should ever be surprised by that, but they always are.
Yeah.
'Cause they'll be like, "Oh, Mom was in the hospital, so we've been taking care of dad for 3 days and we are exhausted and there's 3 of us taking care of him because he's got his days and nights mixed up." And I'm like, "Yeah, now you can understand why your mom was so burned out." Sometimes you just don't always understand until you're the one doing the care, doing the things.
That's 100%,
So
yes.
that's the biggest thing that happens is the primary caregiver takes ill, needs to have surgery, dies, has a stroke, something catastrophic happens to the primary caregiver. And then the kids or if it's an only child gets thrust into it and they're like, "Oh my gosh, I'm an only child. I don't know what to do. I don't have anyone that I can lean on or help guide with decisions. It's all on my shoulders." So that's the stress that the adult kids have is now I have to make decisions for someone. Maybe the adult kids, maybe that relationship is so strained because maybe mom wasn't the best mom. And so there's been this long standing resentment or strained relationships. And now they find themselves taking care of someone or making decisions on the behalf of someone that they don't necessarily really like in the first place.
Yeah. Annalee, one of the things I'm seeing is people that have had kids because of divorce, and then
Yeah.
they've gone through divorce or whatever. The majority of those children do not want to, in any way, shape, or form, have to help the parent.
That's correct.
I'm
Yep.
seeing that so much, and we are in a public health crisis right now where we have more seniors than youth, and every single generation after us has not replaced themselves in population. So
Right.
we are going to struggle now in the next 10 years because of the baby boomers. The tsunami is here. It's on our shores, pounding every day, and it's going to be overwhelming because we have a shortage of professional healthcare workers,
Yep.
and things are going to fall on a parent. Then we have so many that didn't have children, and who's
Yep.
going to take care of them? So there's going to be major changes, and that's why it's so important with somebody like you or I to make people aware that, hey, there are options out there that we may be able to help you. And
That's actually what I wrote my thesis on in 2006 is the
yeah,
changing landscape of senior care because
yeah.
families are much smaller than they ever have been. And so that automatically reduces family caregivers and that automatically is going to reduce the healthcare professional workforce as well. So,
Well, we're also seeing an unprecedented number of nursing homes closing and small
sure.
community health hospitals closing, which
Yeah.
is because the reimbursement's so low for the skilled care anymore. It's not holding up the Medicaid run part of the building where the nursing home
Yeah.
is. So we are seeing, I don't know where we're going with this. I'm doing a podcast in the next month or so on hospital at home.
Yeah.
And
I'm from a small town and I'm from Wellsburg, Iowa, which is about as small as you can get. Like it's not even on the map. I had 18
Mhm.
people in my high school class. Like it's tiny.
Wow.
And
Yes.
even back then, I'm 53. So even back then, like if we needed care, like there was no hospital, there was no home
Yes.
care, there was not, and not only the reimbursement issue for these rural hospitals and rural clinics, but the reality is there's not a lot of enticement for people to go into healthcare because their Medicare cut back. We talked before we hit the record button. We have a shortage of nurses. We've always had a shortage of nurses, but now it's even worse. We have a shortage of physical
Actually,
therapists.
we don't have a shortage of nurses. We really don't. I will tell you what has happened is the hospitals have cut and cut so much that they push nurses to do more with less. They don't nurses, the RNs actually no longer actually do hands-on care unless it's absolutely necessary. And things are getting missed. And so nurses are being pushed out into roles like, I'm a nurse. What am I doing? Instead of hands-on, I'm helping families like you navigate the medical delivery system. And
Mhm.
I have to tell you that they're opening up their own clinics because we have a shortage of doctors and specialists
Yeah.
because Medicare has, again, reimbursed the doctor so low that they don't want to, and the strangulating government regulations that they have to jump through. They need 3 times the amount of staff they used to do in the old days when there was the doctor and his wife was the office manager, that and she
Yeah.
held the books and took care of that. Now they have so many more staff. So we really have our government-run healthcare has created this environment where we have a shortage of everything we need.
Mm.
And Medicare is also moving to a and it has moved to, for a lot, a pay-as-you-go platform. You're going to be more responsible for your healthcare than ever before, and that is really impacting the market right now. But we don't have a shortage of those things. Nurses are in the insurance companies now. They're into other roles because I can remember, I used to love when I went into nursing in 1974. I love nursing. You were able to do things, provide care,
Yeah.
educate, put hands on. Now the nurse and it got in the 90s when I did PRN work because I did
Mhm.
outside consultancy early. I have to tell you that when I started to get physically ill the day before, I would have to be scheduled to go into work. And
Sure.
that's what nurses are experiencing every day now.
Right. Yeah.
And
And
it's really hard.
it's hard, and the pandemic burned a lot of really good
Oh,
quality healthcare
God,
workers
yes.
out, and
Yeah,
we've got really good quality nurses who are just they got burned out. You can only work double
yeah,
shift for so long, and they're working at
yeah.
Home Depot, and their heart's not in it, but they're like, "It's easy work, it's the hours are better, and they're treated better," and so when I say we have a shortage of quality healthcare workers because a lot of it
Absolutely.
the
Yes.
system is broken,
Yeah.
and you can only yeah, so that's why I left too. The system was broken, right? And
Yeah.
so they burn out really good quality workers. And some of us start our own consultancy. We've got more mobile nurses than we've ever had. They're finding a niche so that some of them are still in the industry because that's where their heart is at. But a lot of them are like, I'm done with healthcare because they got so burned that now they're just doing non-healthcare stuff and it's
And you know what? This leads me to the point that I wanna make that things roll downhill and it's where the doctor shortage, the nurses shortage. Now we have a professional caregiver shortage, so everything is thrown on the family caregiver.
mhm,
And
right.
the responsibilities are overwhelming, and that's why I love the fact that you do virtual, and I really feel bad. I wanna talk about aging at home, I want
Yeah.
because it's really getting to a point now where that is the last frontier in nursing, and actually what we're seeing is concierge nurses, concierge doctors, concierge therapists, physical OT, PT, speech. Teletherapy is for not
Mhm.
just mental health, but physical, and OT is very real in our future. And technology is also. So, what are the real pros and cons families need to understand early when they're talking about aging at home?
So aging at home can happen if you have the right supports in place, you have enough care coming in, you have enough quality, reliable care coming in, but by the same token, that costs money. What families don't think about or what consumers don't think about is many of them assume that Medicare is going to pay for all of this home care and it does not. So
No.
clients are paying when I say to Ethels and Marvins, what are your goals as you age? It's always the same thing. We want to age in place at home. We don't want to be a burden on our kids. But guess who is always on Zoom with me for their 30-minute free consult? The adult kids. 'Cause guess
The
what?
adult kids,
Adult
absolutely.
kids are now providing mom and dad's assisted living because they're managing medications, they're getting them to their doctor's appointments, they're ordering food, they're ordering Ubers. And so when people think about aging in place at home, they're not realizing the actual cost. And so I always educate families that none of us are going to get healthier, more able bodied, more mobile, more cognizant as we age. So it's only common sense that we're going to need care as we age and more care as we get old and frail and can't do anything for ourselves anymore. My clients who are aging in place at home, and it's a scary number, but I just need to tell people they're spending minimally $30,000 a month in just one caregiver companion 24/7. Now you need a geriatric care manager because you can't manage your medications, your prescriptions
Yeah.
are running out, and you didn't realize, oh, we need to have a doctor's appointment to renew the prescription. And so geriatric care managers, that's another 150 to $250 an hour. And so families don't realize the actual cost of trying to age in place at home. It's one thing if you have $5 million,
Yeah.
but it's another if your house is of 300,000 is your asset and you're living on Social Security. Trying to stay at home is just not going to necessarily be feasible or safe. One of the other things, and you probably see this on a day-to-day basis too, is mom and dad are hell-bent trying to stay at home. They're not taking care of each other. And so we tried to get home care in there and we ordered home care, ordered like it's a pizza. We lined up home care and we're paying for it as the adult kids, we're paying for it. And that's just not sustainable for kids either unless they want to pay that kind of money. But what happens oftentimes is mom or dad will kick the caregiver out or they won't open the door. And
Yeah.
so anytime that they try to put their version of an aging plan in place, mom and dad will foil it in one way or another.
Exactly. 100%. Yes.
Or what if the caregiver doesn't speak English or isn't the same color as you? Or,
Yeah.
some of my clients that are in their 80s, 90s, and 100s, they still iron. Well, kids that are caregivers, they don't know how to iron. They're like, "What's that?" They're not
Yeah.
gonna mop the floor like you would. And so when people talk about aging in place at home, there's just a lot of things to think about. What if you can't find care because you live in a rural area? Or you live in a really metropolis area, but all the home care companies are at capacity. 30%
Mhm.
of my seniors that are trying to age in place at home are all on waiting lists for home care workers because
Yep.
there's such a shortage, right?
Yeah.
Or what if the caregiver doesn't have the critical thinking skills and your husband keeps throwing his wet incontinence pad into the toilet and the worker doesn't know to just shut off the water valve to the toilet,
Yeah.
like all this critical thinking skill stuff.
Yeah.
Or
Yeah.
what if they don't show up for their shift? Then who's going to take care of mom for the day? And of course, she's going to fall, or she's not going to get her pills, or she's not going to get her toileted, or she's. So, what's the plan then? And unfortunately, families just can't always stop what they're doing or step away from their business or work or
Yeah.
cancel their vacations because dad had another crisis. But guess what? That's what us adult kids do. We bend over backwards.
Yeah.
And disrupt our own lives, our own emotional well-being, our own physical well-being to try to make sure mom and dad have what they need to be safe and happy and have the best quality of life. But the reality is, not everybody's wired to be a caregiver.
Yes.
Not everybody has a relationship. Not everybody can feasibly do it. Like, I just hung up with a family member. He's 3,000 miles from his mom. Every time she falls, I have to take time off work or step away from my business. My spouse is no longer like talking to me anytime mom calls. Like, these are real struggles that caregivers have when they don't have an aging plan.
Yes. Explain what an aging plan is.
Yeah, an aging plan is again, I created a business model to solve for the problem that I ran into literally every day
Yeah.
for 28 years. And that's families not putting a plan in place, or they tried to put a plan in place, but again, mom and dad gave them pushback.
Yeah.
So, an aging plan is where we're neutral family meeting facilitators. Where 85% of my week is spent doing mediation because by the time families are referred to us, because I don't advertise. So, by the time families are word of mouth referral
Yes.
sent to us, they're just simply not getting along. Maybe they never got along, or maybe they were a blended family and they don't even know each other. But now mom had a stroke and we're not having our dad's not going to be taking care of your mom and all this stuff, right? So
Yes.
facilitate their family meetings. What's working well? What's not working well? How do we get mom or dad on board with this concept of aging planning? So I have a whole session that I do with families about how we're going to get mom and dad on board.
Mhm.
Couple little tips. Mom and dad, is it important for you to have a say in what happens to you as you age? Or you know how Uncle Johnny fell and broke his hip and the kids had to make all these big decisions and everything was just such a chaotic mess? We don't want that to happen to you. Or
Right.
mom and dad, what we're doing is not safe. We're not comfortable. We're not caregivers. We're electricians or attorneys. We're not here to wrap your wounds and you're
Yeah.
dressing. And so I have a whole session about just how to get mom and dad on board. But then we do what's called a care matrix. Mom and dad, we educate the families about considerations of aging in place at home, just like what we just talked about. What if the care isn't available? What if your parent can't afford it? What if they kick them out? What if they're not the same color? What if they don't speak English? All those things that are daily issues. What's that big picture look like for current care needs? How much is it going to cost? What are the safety triggers? Mom, you've already had 3 falls in the last 6 months, or you've been in the hospital twice, you've had 3 urinary tract infections, or dad's wandered out 4 times in the night because you're exhausted and you need to be able to sleep. So we talk about what's working well, what's not working well, what are the safety triggers that say, okay, these are the cluster of things that are happening at home. We need to either add more care or bring in care if care isn't even started yet. But
Yeah.
what's the plan? What's the plan if we can't stay at home or you can't afford to stay at home? The care matrix is a done for you
Yeah.
project to say, okay, here's home care companies in your area that are actually taking on new patients. Here's what
Mhm.
their shift minimums are because it's hard to find a caregiver they all want 4 to 8 or 12-hour shift minimums. Here's
Right.
how much it's going to cost. Here are geriatric care managers. Here's what they do.
Mhm.
Here's how much they charge. But here are also care communities. Here's what their levels of care are that they offer. Here's what their waiting list is. We rule out the facilities that have been cited for abuse or neglect, which unfortunately is a lot of them.
Yeah.
You rule out the facilities or care communities that mom or dad wouldn't financially afford. So there's no point in, in families. The value proposition of the care matrix is it saves the families the time, money, and stress of figuring it out on their own, blindly and randomly touring care communities to find out, oh, mom and dad are $2 million short. Or, oh, dad needs memory care and they only offer assisted living. So it saves the families the time, money, and stress of trying to
Yeah.
figure it out on their own. And then the aging plan also, again, not only the family communication and family alignment with care decisions, but it also helps them understand dementia progression or chronic illness because most of them are these caregivers doing a fantastic job, but they don't actually understand why mom is behaving the way she is. She has Alzheimer's. And so they get thrust into caregiving. They're in survival mode, just trying to get through the day. Or let's pray that mom sleeps through the night tonight because I'm exhausted. They don't have the bandwidth or what's called cognitive narrowing. When the more that you're a caregiver and the more exhausted you are, you're paralyzed. You're just trying to get through the day as a survivor, right? You're
Yeah.
not thinking about care for next week or what next year looks like. You're just trying to get through this afternoon. And so the aging plan includes all of those difficult conversations that families are unable to or have tried to have on their own, but it just went sideways because of family dynamics. And then we also do the grab and go binder checklist of what do you have in order? What are you going to do with your dog if mom's in the hospital, or if what is she gonna do with her dog if she has to go to a care facility and she can't have the cat or the dog with her? Where's the VA paperwork? Who's the financial planner? Who's the attorney? All the things that when I was doing the tours, Erica with these families back when I was an employee, that the kids didn't have any idea. They're like, "We don't know if dad has power of attorney, long-term care insurance. We don't know. We've never talked about that. If dad has a stroke, how are you gonna step in and pay bills if you don't even know the which accounts, which passwords, which bills come out of which account?" All of that. So that's what the aging plan is. It's very robust.
And very comprehensive, and that's important because you're offering a plan of from where they are now to the end of their life, and
Yes,
people don't realize that when you put a plan in place, you can stay in charge of your life up until the very last breath, and beyond if you put the
sure.
right paperwork in place.
Sure.
Now, I want to touch base on your book, The Invisible Patient. Can we just talk about
Yeah.
the family caregiver? Because they really are the invisible patient.
Yeah, they are. I should say we, because I'm one of them as well.
Yeah.
We are the invisible patient. I've worked with over 20,000 families in my career.
Yeah.
And I've had literally thousands of adult kids say, Annalee, we love mom and dad so much, but we know that what we're doing is not safe. It's not sustainable. I can't keep stepping away from my business. I have a special needs child. I can't keep, life is busy, but we just can't keep doing what we're doing. It's not sustainable. And so they're like, Annalee, we love mom and dad. We just wish there was like a playbook, a manual of what to do with mom and dad as they age. And so after, I don't know, 3,000 adult kids saying that, I'm like, okay, fine, I'll write a book. So I did. And it took me about 3 years to write it because one of the reasons I started a virtual consultancy back in 2011 is because my own mother was diagnosed with early onset dementia. She had mild cognitive impairment, the diagnosis of mild cognitive impairment, vascular from TIAs. And so I knew that I needed to be and wanted to be where I needed to be to help support my parents as they age. And driving back and forth from Milwaukee to where my parents lived on the farm was a 5.5 hour drive. And I was doing that every weekend. And it's hard to manage life when you're doing all of that. And so I became the invisible patient as well. The
Yeah.
invisible patient is the family caregiver. And I have to say, it always stings a bit when everybody's, hey, how's your dad or how's your mom? You're like, hey, they're doing great, but it's to our demise, right?
Yes.
And
Yes.
the emotional toll of being a caregiver, of just seeing the changes in roles, like for your dad as an example, because I also take my dad lives with me now as
Mhm.
well. Mom passed away from being served the wrong diet in a memory care unit and she choked to death. And so she
Oh,
died very unexpectedly. So the emotional toll of caregiving is not only you're grieving your own loved one, the through the dementia journey and then ultimate the death, but emotionally it's difficult because now you have to be the social worker to the surviving parent, right? And help them manage through the holidays and the day-to-day stuff, and you're still grieving and all that. So the emotional toll of just being a caregiver is not easy, and their needs sometimes take priority over your own needs. And then emotionally, you start feeling short-tempered, impatient, angry, resentful, depressed, anxious, because you're trying to juggle 15,000 things in a day, and it's not sustainable. So the emotional toll of caregiving, and when you start feeling like, oh, you're just uptight and tense all the time, or you're just exhausted, or you've had a change in your appetite, or you're changing sleep, or your friends are like, "Hey, you never come out to see us anymore, or we never get together," and you're like, "I can't because I don't have care coming in," and or you can't take your vacations anymore. All of that emotional turmoil is going to catch up with you, and then that's gonna trigger into physical toll because you're gonna have high blood pressure, heart issues, strokes, all of those types of things are very likely going to happen. But not only the physical toll from the caregiver burnout, but think about if little Ethel is 100 pounds soaking wet and she's taking care of Marvin, who's 150 pounds, and she gets hurt trying to take care of your dad. Or she's trying to bathe in because dad refuses to allow caregivers to come in. So poor little Ethel's trying to bathe in. They're slippery when they're wet. And guess what? If Marvin starts going down, Ethel's going to go down with him. And now you got two parents with two broken hips, and it's not going to work very well. So the physical injury, the other thing I want to share too is because families don't think about this because they wouldn't know because they're in uncharted territory. But the same thing is true for the physical toll of think about if your mom is taking care of your dad, he's in a wheelchair, he has 5 doctor's appointments a month because he's a bigger guy, he's got this heavy duty wheelchair, and just trying to get him in and out of the car and pick up the wheelchair and put it in the trunk or put it in the back seat. Primary caregivers are getting hurt every single day because of caregiving, because the equipment is heavy, they don't know that they can get lighter wheelchairs, or they don't think that they can hire someone to just do those things so that you can just be the husband, the wife, the son, or the daughter. And then the financial toll of caregiving. So my book is The Invisible Patient, the emotional, financial, and physical toll on caregiving. The financial caregiving piece is expensive. Kids
yes.
or spouses are taking early retirement. They're pitching in financially to take care of costs because mom and dad are living social security check to social security check. Or my typical son or daughter is spending $15,000 just in emergency airfare within 6 to 8 months before they contact us for an
Yeah.
AV plan, which is actually now a crisis plan. Because when you get that crisis call and you're in New York and mom and dad are in Tucson, Arizona, it's not $69 on Frontier, right? And so the financial toll of having to pay for all this airfare out of pocket, taking time off work, not taking the job promotion because you're like, I can't have any more responsibility. I've got my own family, I've got aging parents, I have to fly back and forth. And again, all of this is preventable if these families would have had an aging plan. So
Yeah.
it's expensive
It
to be a caregiver.
absolutely is. Yes, and nursing homes, because I was a nursing liaison, a regional nursing liaison, and I also helped do admissions and stuff, and one of the things that nursing homes wanted 15 years ago is probably even more so now. They like a patient that has 3 years of private pay. And people go, "What do you mean?" So I think the days of leaving a home to somebody is your family member is gone, and that needs to be addressed because people don't understand that the government can't take care of all our aging
Yeah.
people, our population. So we really need to embrace the family caregiver and support them, and don't wait until the last minute to reach out to Annalee in regards to care, because you need that support, every caregiver. Annalise, how do my clients find you or my
Sure.
nurse?
Yeah, sure. So they can find me or my team. I have 21 teammates. You can look at us on carerightinc.com website. So care right spelled properly, carerightinc.com. Or you can message me on LinkedIn and connect with me on LinkedIn under Annalee Kruger. And regarding the Medicaid piece that you just talked about, I just wanna super fast talk about
Yes.
that because sometimes families are like, "Annalee, we don't need a plan. We're just gonna deplete mom and dad's funds and put them on Medicaid." When you go
Yeah,
on
doesn't work that way.
when you're on Medicaid, you have no options. You
Yeah,
have no say in where you go for care, who's going to take
yeah,
care of you, and providers are not
yeah,
accepting Medicaid because the reimbursement is just so low. It costs
yeah,
them more money to take on a Medicaid patient
yeah,
than it would a private pay. And
yeah,
so if you didn't plan ahead or you had a medical catastrophe after retirement and that blew through your nest egg,
yeah,
it's gonna be very difficult finding you quality care. That
yeah,
Medicaid and quality care don't go in the same sentence, and so going on Medicaid should not be your plan, and knowing that these care communities, that's why we do the care matrix. How much
yeah,
money do you have to financially qualify to get in here so that now you can do the tour and get on the waiting list
yeah.
so that you don't end up in whichever facility has an open bed because it's not going to be a good scenario.
I can attest to that 100%.
Yeah.
Annalee, thank you so much for spending time with us today. You offer valuable services that I need our listeners to know you're going to need these in the future from
Yeah.
one of us out there that is
Yeah.
supporting the family caregiver, because we are absolutely in a public health crisis. And to my family caregivers, you are the most important part of the caregiving equation. Without you, it all falls apart. So
Mhm.
please learn to be gentle with yourself. Practice self care every day because you are worth it.